It's a pleasure to sorry. It's a pleasure to have you all here joining us this morning, and for our special guest. We do appreciate you taking the time out of your day to join us. So before we do get started, I did want to share a little bit more about the purpose of the meetings. I did see a few new faces, so I wanted to go over the purpose of these monthly meetings that we have. So the mission is to be the voice of the community and to advocate across different sectors across North Carolina. We have three main goals. The first one being to be a multidisciplinary task force focused on Latino and marginalized issues. Secondly, to intensively collaborate with local community partners, community members, and federal and state representatives to educate the communities on different resources available or any up-to-date news. And lastly, to engage in our role as leaders and have consistency in our work. And I do apologize. Today is a national holiday, so happy Columbus Day as well. So I do realize that there is a smaller participation rate today as it is a holiday. Before we get started, I did want to go over everyone who's here. So just so that our guest speaker gets a little more information on who's on the call and gets a little bit more background. So I'm going to start off with Amanda Norwood. Good morning, Amanda.
Excuse me, good morning. My name is Amanda Norwood. I'm the Community Outreach Coordinator at Interfaith Refugee Ministry. We work with refugees and other immigrants to help connect them to the community as they make their Eastern North Carolina their new life here.
Thank you for joining us this morning, Amanda. Next, I have Francisco Guzman. Good morning, Francisco.
Hola, good morning. My name is.
We lost you, Francisco. There we go.
I'm here. Yeah, thank you. My name is Francisco Guzman, and I'm working with the North Carolina Department of Health and Human Services. Thank you.
Thank you for joining us this morning. Next, I have Melissa Swartz. Good morning, Melissa.
Good morning. I'm Melissa Swartz. I'm with the North Carolina Council on Developmental Disabilities. I'm a systems change manager. The Council on Developmental Disabilities, I'm a staff person to a 40-member board that helps to allocate about $2 million a year in support of folks and families with intellectual and developmental disabilities.
Awesome. Well, thank you for joining us this morning. Next, I have Tim Little. Good morning, Tim.
Good morning. I'm the Fund Development Director with Robeson County Partnership for Children. This is the first meeting I've attended, and I'd received an invitation and just wanted to see how we may be able to help here in Robeson County.
Thank you for joining us, Tim. Next, we have Vanessa. Good morning, Vanessa.
Hi, good morning, everyone. My name is Vanessa Guzman. I am the Community Outreach and Family Support Specialist with Wake County Smart Start. We specifically focus in Wake County and have early education programs for little ones under 5 years old.
Awesome. Well, thank you for joining us this morning. And next, I have Leanne. Good morning, Leanne.
Hey everyone, Leanna Martin, NC Child, Early Childhood Education Policy Analyst. Excited to be with you all today and present kind of what's going on with the North Carolina policy landscape for children and families. So I'll talk more about who NC Child is here in a little bit.
Thank you for joining us this morning. And next, the rest are staff. So I will have them input their information in the chat box, just so you guys have their email information as well, in case there's any department within a Mexican that you need references or resources to. So next we have Leanne. So Leanne is the Early Childhood Education Policy Analyst at NC Child. Leanne is a longtime North Carolinian. Leanne's first job as a child care floater was supposed to be just a summer gig, but it sparked a passion that continues to drive her work today. No matter the role, she has always found herself immersed in efforts to improve outcomes for children and families. As a former high school teacher and nonprofit analyst, she focused on making data and policy accessible, believing that common ground exists for everyone. Most recently at UNC Chapel Hill, she worked with operational excellence and the Adams School of Dentistry to streamline processes for faculty and learners, ultimately leading to better outcomes for patients and families. Now, as an early childhood education policy analyst at NC Child, she is excited to contribute to meaningful, lasting change for children and families in the state she proudly calls home. Leanne holds a Bachelor's of Arts in Spanish from the University of North Carolina at Greensboro and a Master's of Science in Counseling with a concentration in Holistic Child Development from Lee University. She is currently pursuing a PhD Educational Leadership Policy and Human Development with a concentration in Educational Evaluation and Policy Analyst at North Carolina State University, where her dissertation focuses on the North Carolina Child Care Stabilization Grant. While she's not working or deep in dissertation research, she enjoys exercising, spending time with her partner, and spoiling her 3-year-old cat, Morena Jolene. Well, with that, I'll pass it over to you, Leanne, and thank you for joining us this morning.
Yeah, thank you all so much for having me, and what a wonderful introduction. I'm going to share my screen and get everything going. I need a request, yeah. All right, perfect. So yeah, I'm so excited to be with you all today. I will say I have my presentation notes up here and I have the presentation itself. So if there are any questions, I'm happy to kind of field those at the end. I also like to give the caveat that I'm going to talk about early childhood education policy in North Carolina, as well as health policy. I am not a health policy expert. I work very closely with our health policy manager, Caitlin Richards, who helped me with parts of this. So if you do have any questions with the health policy side, and I'm not able to answer them at the end, I will make sure to get those to people that can, and we will get answers for you all in the week. So I kind of want to start out with just who NC Child is. So our mission is to advocate for policies that improve the lives of all North Carolina children. And our vision is that every North Carolina child has the opportunity to reach their full potential. And I want to show my why. Why do I do this work? So it starts out, the 3 little boys are my nephews, and the little girl is my niece. And they're the reason that I am involved in this work. It
I'm
was
sorry,
actually,
we,
yeah.
we can't see the screen.
Oh,
So I'm sorry.
okay.
I want to make sure that
I'm just talking along. Oh, yeah. It would probably help if I press share. There.
There we go.
So sorry.
Thank you.
Yeah, it would have been really unfortunate if I was showing y'all pictures of my cute little niece and nephews and you couldn't see them. So anyway, I really appreciate you letting me know, because I would have just went straight through that presentation and not even noticed. So the 3 little boys on the left are my nephews, Benjamin, Isaiah, and Ezra, and the little girl on the right of the screen is my niece, Emery, and they are the reason that I am so involved and entrenched in early childhood policy. They are all North Carolina children. But my brother and sister-in-law and my brother-in-law and sister-in-law have all experienced issues with early childhood education access and affordability that's ultimately hindered workforce opportunities and strategies to build their family more. So that is why I do what I do. It was actually my middle nephew Isaiah's birthday this weekend. And so while he is no longer within my early childhood sphere, knowing what's kind of affected them is the reason I do what I do. So just as a quick rundown of what we're going to talk about, I do have a lot to go over, and I'm going to try to make sure I can get everything in the time allotted. But we're going to talk about the policy landscape, what's going on state and federal, legislation of interest that we're kind of tracking and interested in, and then policy solutions that we believe at NC Child can really help address some of the issues going on. I will also just make it very clear that some of this conversation is heavy. And so we will just give each other grace in that, knowing what the federal and state policy landscape looks like a little bit right now. So starting with the policy landscape and starting with what I know best, early childhood education. So in 2024, we worked on a study. We worked with the U.S. Chamber and the North Carolina Chamber to look at what is the current impact of lack of access to childcare in North Carolina. And approximately 207,000 parents are not at work or have work disruptions due to school or childcare issues. And why does this matter? There's a huge impact on this. In that same report, we found that North Carolina loses about $5.65 billion per year from child care issues, including $1.5 billion in state tax collections and a little over $4 billion in business activity because of turnover and absenteeism because of child care issues. But we also partnered with the North Carolina Department of Commerce to see what would it look like if we could solve some of these childcare issues. And from that, we found that if we could solve issues for working parents, it could create up to $7.5 billion increase to GDP. So everything that we're currently losing from childcare, if we could solve it, we would not only make that up, but then turn over about a $2 billion profit from that as well. And from that, we could also see up to 60,000 new jobs, either directly or indirectly, from this work as well. What we all know is that the price of childcare is rising rapidly. It's outpacing other goods. So since 2000, childcare costs have increased by over 135% compared to groceries and housing. And just total prices in general. So when we were talking about inflation, childcare has been the sector that has been impacted the greatest out of all. And it's important to know that the average cost of childcare, it stresses in family income. So the Department of Health and Human Services, the federal DHHS, in past years talked about the affordability of childcare as 7% or less of a family's income. There is, continued debate around that. But in North Carolina, it's around for a married couple or a two-parent household, it's about 11.5% of the median income. For single dads, it's about a quarter of the median income. But for single moms, it's almost 40% of the median income for childcare. And the supply of childcare doesn't meet the demand from parents. So there are about 732,000 kiddos under 6 in North Carolina, and about 461,000 of those children have both parents working. But licensed childcare capacity is sitting at 362,000. And it's declining rapidly due to just through the overall cost of childcare and that providers are unable to sustain. So going into healthy children and families, so thinking about child and family health. There is a shortage of community and school-based providers. So what I mean by that is it's both physical and mental health, and there's a shortage of specialty providers for children with differing abilities as well. So there's just an overall shortage of providers. And the rate of behavioral health diagnoses continues to rise. And the 14,000 number here is looking at the innovations waiver, the Medicaid innovations waiver, wait list of over 14,000 children on that. And there's growing concerns that by the time parents can access services, their child has already aged out. And so this number continues to grow, and there's a lot of concerns around that as well. As we're thinking about the youth mental health crisis in North Carolina, from the DHHS State Center for Health Statistics, 4 out of 10 North Carolina high schoolers reported feelings of persistent sadness or hopelessness in 2023. And what's really important to note as well with that is that 54% of North Carolina children who need mental health care have difficulty or cannot access those services. we often see that school-based psychologists, school-based counselors, their ratios are far extended to what they should be. And there is not a really great pipeline at the moment for getting school-based psychologists and providers into the schools. So going into Medicaid and HR 1. So kind of starting off with this, I want to preface that I am going to give you as much information as I know about Medicaid and HR 1, but I am certainly not the expert, but I do really hope that if you have any questions, please ask me and I can get those to my colleague. So Medicaid, there's a state budget shortfall for the rebase, which is the current baseline funding to match the current utilization. And that is in no way related to Medicaid expansion. There's also a number of federal changes that will be effective over the next 3 to 5 years, and I'll break those down here in just a minute. And not only are those funding changes, but they're programmatic changes as well. And in North Carolina, because we have not because the General Assembly has not been able to agree on the funding for the rebase, all providers have experienced at least a 3% rate reduction, but specialty services, excuse me, such as behavioral health providers have experienced higher rates of higher rate reductions. So some provisions from HR 1. It limits the state provider taxes and state directed payments. There's eligibility redeterminations. Instead of every year, it's looking like those are going to be every 6 months. There's also the addition of work requirements. There's increased out-of-pocket costs. There's restrictions on access for immigrants, and there's limited funding for emergency Medicaid. Right now, there's some conversations going on around emergency Medicaid funding at the state level, but there, with the provisions allocated in HR 1, there will be limitations to that in the future. So as I was talking about those provisions changing, here's what's going to kind of happen in the next few years. So immediately there was a prohibition on new or increased provider taxes, new limits on state-directed payment rates. In January 2027 is the every 6 months for the renewal for expansion enrollees, and then work requirements then begin. October 2027, there's a rate phase down for provider taxes. And then in 2028, phase down begins on state directed payment limits. And October 2028, there's mandatory cost sharing for expansion enrollees. So there's a lot of conversation about what that's going to look like for the state. So provider taxes. This was really helpful for me, and I thought I would share it with y'all as well. So what are provider taxes? They're healthcare related taxes that the state levies on a wide range of provider types, most typically nursing facilities, hospitals, and intermediate care facilities, and/or managed care organizations or MCOs. And what is changing is that states are now prohibited from establishing any new provider taxes or increasing the rates on existing taxes. And starting in 2028, existing taxes will also start to be phased down by a rate of 0.5% annually. And all of that for me as a non-Medicaid person could seem really confusing. So what is the impact? It's going to make it difficult for North Carolina to continue raising sufficient funds for Medicaid, which will further decrease the amount of federal matching funds flowing to the state. So when you were phasing down those provider taxes, North Carolina's matching is going to lower, which means the federal rate's going to also lower. So it's going to make it more difficult to have the funding we need to support the Medicaid infrastructure that we have now. State-directed payments. So state-directed payments, states can require that MCOs increase the provider rates or set minimum rates for certain types of providers. And the previous rule was that rates were permitted up to the average commercial rate. And what is changing? Expansion states are now prohibited from instituting new state-directed payments that exceed Medicare rates. And that is a payment level that is much lower than the average commercial rate. And then starting in 2028, all existing SDPs will be phased down by 10% percentage points each year until they comply with the new limits. again, for me, that is a lot of words that I wouldn't understand without understanding what is the impact of it all. With rates to providers being held stagnant and being reduced, it is likely we'll see providers scale down services or be at risk of closures. And this is going to be felt specifically for rural hospitals. So when we hear kind of conversations about what's going to happen to rural hospitals, this is what is driving a good bit of that. Did I keep it? Yeah. Work requirements. So this has been a hot topic for expansion in particular. Expansion applicants aged 19 to 64 will be required to work or participate in other qualifying activities for at least 80 hours a month, or be attending school at least half time. And this verification is going to be within each month of a renewal and at each of enrollment and at each renewal. So they will have to do this verification every 6 months. Some exemption categories for this are parents with children 13 or under, pregnant individuals who are receiving postpartum or those receiving postpartum coverage, individuals who are medically frail or fragile, who have special medical needs, and former foster youth. So what's important to note here is this verification. If people are trying to work, verification every 6 months is going to be very difficult logistically. So legislation of that we are continuing to watch. I will also just go ahead and preface, we do not have a budget yet. And so we are still waiting on what the budget could actually be. So looking at early childhood education first. So there were over 40 ECE bills introduced and 24 passed crossover. So what crossover means is that after a certain deadline, the bills needed to meet a certain criteria in order to continue to be considered into the short session in 2026. A couple of those criteria points that are important to know is if they pass through one of the chambers, either the House or the Senate, and they've been directed to the other chamber, if they were funneled to appropriations, or if they were a base budget bill itself, they can continue to be considered. Some bills of note. I am still going to talk about House Bill 389, even though it had some changes over the past couple of weeks. We know that there's a shortage of childcare providers in the state. House Bill 389 directed, in its original form, directed the Child Care Academies program, which was very important to looking at as a fast track opportunity for individuals who have never worked in a child care facility to receive their credentialing to be a lead teacher. It was a 2-week program. It pays for fingerprinting. It pays for all of the necessary paperwork so that once the individual is out of the child care academy, they can then go into the classroom. So this not only looked to establish a couple of programs in Johnston and Wayne County, and wanted to expand to 10 other programs within the state. We did see that the Child Care Academies was written into the House budget, but not the Senate. So we are hopeful to see what funding might occur from that once a budget is passed. House Bill 412 is probably the most widely discussed bill that has been passed by the House and Senate and was signed into law on July 1st. It created regulatory reforms for childcare. A couple of those were deregulation or decoupling of the child care subsidy program from the quality rating and improvement system, to have a study to see what that would look like. That does not mean that it will be implemented next year, but it did direct the Department of Child Development or the Division of Child Development and Early Education to conduct a study with that, along with the 2025 market rate study. It also created some flexibilities within the classroom. So it increased group sizes for many of the toddler classrooms, and and infant classrooms as well. It did not change staff to child ratio, but it does allow for one teacher to oversee 2 groups of children. And it does have some coding regulation reform for family child care homes in order to expand their capacity. It also directs a task force to look at liability insurance, group insurance cost, to better understand what would it look like to lower those, because we know liability insurance is huge for childcare providers. And while it's not required, it is very much needed. Senate Bill 412 is sitting in appropriations. It's the largest allocation of childcare funding for the year. It's looking at $123 million to increase to the 2023 market rate study, and then adds additional percentages of an additional 10% for rural communities, as well as an additional 10% for infant toddler rates. That was sponsored by Senator Ralph Hise. House Bill 542 is the child care mental health bill that would allocate an additional $8 million to the North Carolina Partnership for Children to look at expanding telehealth services for mental health for children, families, and providers. House Bill 800 would establish a child care pilot program that would allocate $10 million to create a protected status for subsidized childcare for lead teachers in childcare programs, as well as allocate funding to fast track assistant teachers to become lead teachers through additional funding for the Teach Scholarship Program. And then House Bill 877 is a child care pilot program bill that would establish a state-owned structure and work in partnership with the university to create funding resources to create a child care program that would be less than the market rate, but would pay teachers above what current allocation or current estimates are for the state, and would provide insurance as well. So looking at healthy children and families, some bills of note. Senate Bill 77 is school contracted health services. So if a child receives special care or therapy, it makes it easier for them to also receive those services within the school, and it improves parent choice for services for children. Senate Bill 259 is the school psychologist omnibus bill. So if you remember, we were talking earlier about how we do not have enough providers in school-based or in community-based settings for mental and physical health. The goal of this is to increase the compensation for school psychologists, increase the number of school psychologists in unserved districts, and to establish a school psychologist internship program to improve the pipeline from the UNC system. And then House Bill 519, I'm going to give you just a brief overview of that. It's the Parental Bill of Rights. It's really around what consent do minors have over their own health care. It passed the House and is in Senate rules. It limits a minor child's right to consent to their own medical procedures on their own without parent knowledge or consent. Exemptions can include that delay that would be harmful if the child cannot be identified, or if whatever condition or injury is likely to trigger mandatory report. So still watching that. There is little that I can say because there's little that we know about it so far. A lot of it is still being fleshed out. The Jason Platt Act, this is a policy priority of NC Child. It makes a requirement that all public school educators would go through suicide prevention training on an annual basis. It passed the House unanimously, is now in Senate Ed. And then House Bill 959 is the internet safety and social media within schools. And it requires all school boards to have a policy about phones in schools. And they must also have an internet safety policy that's age appropriate and curriculum relevant. So what are some policy solutions that we have been considering and are looking at NC Child? So the first one is establishing for early childhood education is to establish a statewide subsidy floor. This is what is considered creating a minimum reimbursement rate. In North Carolina, we have over 3,000 reimbursement rates for the child care subsidy program. And they vary based on the location. What we know is those variances do not account for pretty similar fixed costs, so utilities, rent, insurance, things like that. And so we are advocating for a statewide subsidy floor that would establish for infants $1,400 for infant 5-star care and center-based care. And here's what it could look like if we had this. So you can see the varying numbers right now and what this could bring up to. So somewhere like Randolph could see almost a $500, a little over $500 increase. And it establishing a statewide subsidy floor levels the playing field for all families, regardless of zip code. I'm from Stokes County. This would be huge for Stokes County providers. Another one that we are looking at is the Child Care for Child Care Workers, very similar to House Bill 800. The Child Care for Child Care Workers program was started in Kentucky and created a priority classification for subsidy for all child care workers that work 20 hours or more, regardless of their income or regardless of their position within the school or within the program. And has had great success on not only recruitment and retention, and we partnered with the child care resources as well as early years to see what that would look like in North Carolina. And almost 80% of providers believe that this would be a fantastic tool to not only recruit but retain, and it would also free up some of the funding that they are already spending to provide discounted childcare. So we are working closely with the GA to see what could happen with House Bill 800 and if there are ways to expand that. So with health policy, we are looking at improving staff ratios for school-based mental health services, very similar to the school psychologist omnibus bill. Increasing telehealth and school-based services in general, we are looking at, and then ensuring children on Medicaid are able to access the services they need. Those are pretty straightforward, but really large policy priorities that we're looking at. So I think I have wrapped up there. I will happy to take any questions that I can answer, and also happy to take any questions back that I need to.
Well, thank you so much, Leanne, for that great information and overview of what's going on in North Carolina related to health and education. We really appreciate it. I'm going to open it up if anybody would like to raise their hand or unmute. And if not, I have some questions, Leanne. I know you mentioned a little bit about the state-directed payments, how those will be affecting the rural hospitals. Has NC Child came up with some immediate, things that we could do as nonprofits also to help and support those hospitals to not be as affected with what's going to be happening?
Yeah, I think we are still very much in the trying to understand what exactly might happen, because the bill, with HR1, it's still, I think everyone's still trying to understand best what's going on. I think the best thing that advocates could do is just continue to listen to what rural hospitals are saying. We always say that we're data driven and community informed. So if y'all are hearing something, please let us know, so that we can better inform our advocacy efforts going into the phased implementation of different aspects of HR1, and that we can make sure we are working with our hospitals as well as best as possible.
Awesome. Thank you, Leanne. I'll pass it to you, Vanessa.
Yes, very quick question. I just wanted to go back to the slide that showed the 14,000 on it, and I think it was the rate of behavioral health diagnosis that continued to rise. Do you mind sharing once again? I might have missed it, but what that number entailed?
Yeah, so the 14,000 as well as for the innovations waiver wait list at the moment. So these are given to children or families with children 18 or under that have different complex medical needs. And these innovation waivers number has risen to the point that many children are not able to access these services, or parents cannot access these services for their children before they've aged out of the innovations waiver. So there's been a lot of conversation around increasing innovation waiver allocation for funding and things like that in the General Assembly, but just hasn't happened. So as behavioral health diagnoses continues to rise and more individuals need access to the innovations waiver to access these services, they are unable to.
Thank you.
Absolutely.
Is there anyone else? I did have one, Leanna, also. The work requirements slide, it said, how Medicaid will be changing from the ages of 16 to, I forgot the max age. When will these changes occur, for them with the whole renewal every 6 months and things like that?
Yeah, so I'm going to go back to that slide just to reference it a little bit. Sorry if y'all are getting a headache seeing me do that. I'm going through a lot of them. So it's by the way that I am reading the information that's been provided is that work requirements would start in January 2027. And so what that means is, and I'm not DHHS, so I'm not exactly sure what that would look like, but I would guess as people are starting to do their annual renewals before the recertification period changes, they will probably need to start looking at that work requirements aspect. I know that we are, as this is part of HR 1, we are continuing to gather information on what other states have done around implementing this change. Because while it is 2020, it does say 2027, the way that HR 1 has been interpreted is that that's kind of the deadline to get those work requirements put in. And so as North Carolina is trying to figure out what that would look like, it would be that it could happen sooner. But they are looking at different processes that other states have been doing with expansion.
Thank you, Leanne.
Yeah.
Did see Francisco said something that they have the same information, no extra information to share about the statement. Thank you. Are there any other questions or comments?
Will we be able to get a copy of this slide deck?
Yeah, I'm happy to send the slide deck over for y'all for sure. I'll send that to Marlene after this presentation.
Thank you.
Thank you. And specifically, are there talking points that you all recommend for the rural hospital crisis?
Yeah, I will reach out. I don't have those talking points, but I will ask my colleague to see if we have any or what we are still kind of tracking when it comes to that. But I'm happy to work with my colleague and get those as well.
Thank you.
Thank you, Leanne. Well, we appreciate it again for coming out and speaking this morning. It's one last question, Rodolfo. We'll close this out and we'll move on to the next thing.
So sorry, I don't know if it was mentioned or not, but are there key legislators we should be contacting or focusing on?
Yeah, I think, reaching out to, your local constituents, I think is really important. We do have some, we have some Medicaid champions in the House, and having your voice heard and speaking with them about what they're looking at. I know, it's very, very well known. We've had Dr. Campbell, Representative Grant Campbell, who's really kind of worked on this stuff as well. has worked on some of the Medicaid rebates for the House, talking with any kind of, your majority legislators, the ones that have some authority in the House and the Senate as well. I think just reaching out to your legislator in general, whoever that is, and just making it, clear, it's important that we protect Medicaid in North Carolina. It's important that these services are accessible, Medicaid and Medicaid expansion to all of North Carolina. So just continuing to do that. I know who our power legislators are really in ECE, but thinking about with health policy as well, just very much the similar, who your appropriations chairs are, who are your health policy or your health committee chairs, reaching out and talking with them.
Thank you, Leanne.
Yeah, absolutely.
Well, we appreciate it again. And as you mentioned, we will be sharing a slide deck after this presentation, well, after this meeting, so that you guys have that information as well. The next thing I had on my agenda was upcoming events. So I will share those. Sorry. And I did mix up the agenda, so I do apologize for that. So this week we have our Latino Festival coming up on Saturday, October 18th from 11 to 5 p.m. It's going to be in Greenville at Wildwood Park. We do have spaces available, not many, but we do have a few. If your organization would like to set up a table and join us and share a little bit more about the resources that you guys have. We are also still accepting volunteers. If you guys have any high school students or college students that are in need of volunteer hours, we are requesting volunteers for that day. Tasks will include setting up, directing parking, and distributing flyers and cleanup at the end of the day. Next, on October 25th, we have our Day of the Dead Festival in partnership with Seeds of Hope of Wilson. This will be in Wilson County at the Whirligig Park. If you're interested in having a booth as well, we have spots available. And again, we are also seeking volunteers. The event is from 10 to 4 p.m. Next, today at 4 p.m., we have our food drive in Wilson County. So culturally appropriate. So if you know anybody who's needed food in Wilson County and surrounding areas, please send them our way. We're going to be out there until the food is gone. On November 5th, we are going to be having our last North Carolina Disaster Recovery Alliance meeting. We're going to be having Michelle Reese, who is a PH candidate for the Bill Anderson Fund Fellow, and she is a graduate teaching assistant for climate risk and storm hazards lab, and she's from the University of Florida, who will be sharing a little bit more about. She actually came from Florida to do a project to North Carolina and do a little scope of all the disaster and emergency managements across the state. So she's sharing a little bit more information on what she was able to find and some strategies on how to improve. On October 31st, on a Friday, here in Pitt County in Greenville, we're going to be having a breast cancer awareness 5K. If you guys are interested in supporting and coming out to do a small run, walk, however you'd like, please be here to join us. We'll be sharing more information in the newsletters as well. And I will pass this over to Rodolfo to share a little bit more about this meeting.
Thank you, Marlene. So I won't take up too much more of y'all's time, but on October 23rd, we will have our second meeting, well, our third meeting for the Eastern Rural North Carolina Community Resource Network. We'll have guest speakers from the North Carolina Justice Center, the National Single Player Association, and then some from the NC Medicare for All Coalition as well. So we ask you all to join us for a panel discussion that will address the challenges rural communities face under a profit-driven healthcare system. And our speakers will explore solutions to make healthcare more accessible, affordable, and equitable for all across North Carolina, and how we can go about advocating for such a change. And we look forward to having you all on October 23rd from 12 to 1:30 via Zoom.
Thank you, Rodolfo. Next, our English classes have opened up again. So these are every Wednesdays and Fridays. On Wednesdays, they are in the evening, so they're from 8 to 9 p.m. And on Fridays, they're from 10 a.m. to 11 a.m. And these are all hosted on Zoom. The classes will be intermediate level. Everyone is welcome to join. There's no fee, it's all free. So if you know of anybody who's interested in taking some English ESL classes, please be sure to send them our way. On Thursday, October 23rd, we're going to be having our Niños del Futuro, how parents, the los padres como maestros de sus niños de edades de 0 a 6, so how parents can become teachers for their kids from ages 0 to 6. We're going to be having a speaker, Maria Perez, who's an educator for parents at the Association of Martin Pitt for Kids. And this will be hosted virtually on Zoom at 6 p.m. Eastern Standard Time. Next, Christmas is coming right around the corner. So we have opened up our Toys for Tots registration form for kids from ages 0 to 12 to receive a toy and join us for our Posada Navideña, which is our Christmas celebration at the end of the year. Toys will be picked up in Greenville. So more information will be shared as the details and dates are secured. But if you know any families in the area of Pitt and surrounding counties who are in need of toys, please be sure to give us a call and we'll be happy to register them for this event. And lastly, we are accepting applications for interns for the next semester, as well as volunteers. And that is all I have. I did want to give some space. I did miss this part in our introductions. If there's any updates from any of you guys that you guys would like to share of upcoming events or trainings. I know Francisco did put some in the chat box.
Yes, Marlene, thank you. I put in the chat, we will have language access training coming next week on the 23rd. If you guys want to make the registration, the link is over there. And please, if you can help us to spread the message, it's focusing a lot to health providers, but as well those who are working very close with families and been having some inconvenience regarding language access.
Thank you.
Thank you.
Are there any other upcoming events that any of you guys might want to share? If not, I hope you guys have a great rest of your Monday and a great week. It's feeling like fall, so hopefully it stays like that, and we don't get warm weather again. But with that'll be the end. And thank you guys for joining us today. Have a great one.